You're welcome to Little Angel's Corner, your favorite channel on parental tips for your little ones. Have you noticed recently that your toddler is not quite right? That is, do you have a gut feeling that there's something not quite right with your baby? Well, today we're going to be talking about autism. Autism is a developmental disorder in which the baby perceives his world differently in terms of communication ability, in terms of speech, in terms of social interaction, so that autism is the outcome of the way the baby perceives the world and environment around him. Well, it is a disorder, like I've said. It is not a disease. Therefore, it has a management process. It cannot be cured, but it can be managed. So, really, there's nothing to worry about. It's good for you to know these signs of autism because when it is picked up early, it helps the pediatrician to help manage your child with other experts on this field. And the child eventually turns out right and thrives like his peers. So, what are the areas in which you, the mom, should look out for in this baby that you think there's something not quite right? There are five major areas. In terms of communication, it's obvious in a child that has autism that is unable to start communicating by 16 months. One would expect that by 16 months, a baby should at least be able to say two syllable words like dada, mama. But an autistic child finds it difficult to do that. At this point, let me tell you that autism usually manifests by 3 years. However, it may take a longer period to manifest in some children. Apart from inability to develop speech at the appropriate time, other areas in communication that are affected is when you call the child's name, he doesn't respond. He's like he's not bothered about his environment. He's just like in a world of his own. Doesn't respond to his name. And then, usually toddlers, when you play with them and you ask them to point to an object, they're always very willing to do that. But this child is not ready to obey commands. You ask him to wave bye bye. He's not interested. He doesn't want to follow your instructions. And then there's this other thing about autism. As a mom, you may tell your child, see that you play with your toys. So eventually, when the child gets to that age where he can express his speech a bit better, an autistic child will keep repeating the last few words you have said when you're talking to him. You probably keep hearing him say, your toys. And he keeps saying that for so long so that it's inappropriate. So they're inappropriate responses to your sentences. In the medical term, we call it echolalia. In terms of communication, these are the areas you should look at. The child is a bit slow in communicating. Then, in terms of socialization, you'd expect a toddler to be warm, cuddly, and want to embrace the mom or his siblings. But an autistic child would rather shy away. He likes to be left alone. He doesn't want to play with anybody. He just wants to be left alone. So when you see a child that likes to keep to himself a lot, it should raise some red flags. Also, you see a child that instead of playing with his toys, what he does is just arrange the toys in an awkward manner, in an obsessive manner, as if these toys must always be arranged in a straight pattern. That also raises a red flag. You also notice that such a child, the way he interacts with his peers is a bit different. Sometimes they, apart from being withdrawn, they react inappropriately to the way they interact with their peers. At that age of being a toddler, you know that many children like to play pretend, like they pretend they are mommy and then they're cooking in the kitchen. Others will pretend that they are firemen and they are driving their fire vehicles. But this child is not interested in anything play. He just wants to be left alone. So, in terms of another area, in terms of repetitive behavior, apart from having this echolalia that I spoke about, where the child keeps repeating the last three words that you have said, apart from that repetition, the child also likes to flap his hands in front of his face. He keeps flapping in a repetitive manner. It's awkward for a child to keep doing that. So it's a warning sign. You also find these children, apart from flapping, they also like to rock. They keep rocking on themselves continuously. You see them doing that for like 5, 10 minutes. And as much as you try to grab their attention, they are not even interested. They are not aware of their environment in any way. When you see all those, you should raise a red flag. And then this child as well, an autistic child, would like to see, he has a fixated gaze on anything that is spinning. He just keeps staring. Like if you have a fan in the room, he's always staring at the fan, he's staring at the circular motion of the fan. Or if it is the wheels of one of his toys that keeps moving in a circular manner, he loves to stare at it for minutes on end. Another area where you may pick up abnormal behavior in your toddler if the child is autistic is that they have inappropriate responses to bright lights. They don't like seeing very bright light. They respond in a very abnormal manner. They scream and shy away from it. Also, you don't see the children, autistic children, staying in a very noisy environment. If there's anything that causes a lot of noise, you see them closing their ears, shaking their heads. They don't want to listen to that type of noise at all. It's an abnormal behavior. Some other children may listen to noise and not react in such an exaggerated manner like autistic children. And another thing about autistic children is that you shouldn't break any rhythm that they are doing. If you see them arranging their toys in a straight line and you try to break it, they get very upset. They start throwing tantrums. They also react inappropriately to some other sensory stimulus like pain. If you pinch an autistic child, he may even behave as if he didn't feel no pain, there's no pain at all. On the other hand, he may react in a very exaggerated manner. There'll be a wild outburst from the child. Some other areas to look out for in these children, some of them do have delayed developmental milestones. You know, at a particular age, you expect a child to sit, to walk, and socialize, especially in terms of smiling. Autistic children don't smile. Autistic children don't like eye contact. They shy away from all those things. And then, in terms of their sleep pattern, it is irregular, very irregular. You can't say specifically that this is how this child sleeps. And also, in terms of their eating habits, they don't have a definite pattern for eating. They eat whenever and whatever they like. You'll just notice that this is not the normal child routine. There's something a bit that is not just right. However, the good news is that there is no need to worry because, like I told you at the beginning, autism can be managed. It is a multidisciplinary approach to the management of autism. You have your neuropediatrician, you have the behavioral therapist, you have the speech therapist. They're all there to help manage your child. So if you see any of these red flags, please take the child early enough to his pediatrician. But let me point out at this stage, it doesn't mean that if a child should exhibit two or more of these signs that he is autistic. No, no, no. It may just be a variant from the normal. So it's for the mother to be very observant, to keep observing and see, are these signs persisting? Are they really abnormal? But immediately you feel uncomfortable because as a mom, you always have this gut feeling of what is right from what is wrong. Whenever you have this gut feeling about your baby, please do not hesitate because if they are caught early and managed appropriately, they turn out to be the best of children. As we know, some of the world's best scientists are autistic. So there is no need to worry. They thrive just like any other child. So continue to give that your child, that's your baby, tender, loving care. So I hope that I've been able to point out the very salient areas in this condition, which, like I've told you, is not a disease. A child can live and cope with it very well, and it can be well managed. So if you have any questions, please drop in the comment section. I'll definitely respond to your questions. Also, if you have enjoyed this video, please like, share, and subscribe so that other mothers can have access to this video so that together we can build a community of well-informed moms with bright children. Thank you. Bye. See you in my next video.